is Dan Clair. I'm Chair of Vascular Surgery at Vanderbilt University. Both studies involved an independent adjudication committee that had evaluated the patients to assure that they were no-option patients with critical limb ischemia. They were all Rutherford 5 and 6. The only difference was that end-stage renal disease was included in the PROMISE 2 trial, and that made up about 20% of the patients in PROMISE 2. And, importantly, the outcomes of that analysis were that they were very, very similar. So despite the fact that we had moved the technology to a number of new sites, there were no roll-in patients, so this was the first experience for some of these investigators in doing this procedure. The outcomes were the same. And that actually is really good because it means we can get this technology to more experienced interventionalists with good wound care affiliates and assure that the patients have good outcomes. And the ALPS registry, when you look at it side by side with the PROMISE 1 and PROMISE 2 data, the limb salvage is very similar, close to about 70% at 12 months, and amputation-free survival just between 60 and 65%. 63%, I think, was the number. So these all indicate that, at least for our beginning experience, we're doing very well when we compare this to historical controls, which have been literature-based, where that amputation-free survival at even 6 months was about 55%. And when you compare this to the CLARITY study, where the amputation-free survival at a year was less than 30%, this is a real advance for these patients. We've initiated the PROMISE 3 trial, which is another look at 100 patients post-market approval. And the goal there is to really look at further dispersion or a spread of the technology and the use of the product, and again, focusing on outcomes in patients. There are several issues that we've identified in the data from the PROMISE 1 and PROMISE 2 studies, including, in PROMISE 1 and 2, about a third of the patients required a transmetatarsal amputation. We'd like to improve on that and see if we can reduce those numbers of patients getting transmetatarsal amputations, and additionally, try to better identify the mechanism of action of this. We know that there's an improvement in essentially the vascular system in the foot that distributes oxygenated blood, but identifying exactly how that happens and making sure that we can reliably induce those changes would be very beneficial. And those are the things we're going to be looking at moving forward.